Gracia, a former registered nurse, knows the importance of seeking medical attention when experiencing unusual symptoms. So when she began suffering from pelvic pain, she went straight to see her doctor.
He noticed also that my uterus was enlarged. So he was concerned about that, and we decided that the treatment of choice would be a partial hysterectomy.
Despite being the second most common surgery among women, with more than 500,000 performed each year according to womenshealth.gov, Graciela, a 40-year-old mother of 4, was still concerned about getting a hysterectomy.
I've had family members and friends who've had hysterectomies, and they're pretty invasive. They do leave a scar, and it's a long recovery time. So I did get a little bit nervous.
But Graciela's obstetrics and gynecology physician, Dr. Patrick Chisholm, helped ease her fears. He recommended she undergo laparoscopic single-site surgery, or LESS surgery for short, a procedure first performed south of San Antonio by Dr. Chisholm at South Texas Health System, Edinburg. The minimally invasive procedure, which involves a single incision, is also known as no-scar surgery.
It's just a tiny incision through the belly button, and that alone to remove the uterus or sometimes other structures like the fallopian tubes or ovaries. It's nice also because it's a little more cosmetic. It's hidden within the fold of the belly button, so you essentially can't see it after the surgery.
Considered the next frontier of minimally invasive surgery, there are benefits to the LESS procedure beyond the cosmetic, including less pain, a shorter hospital stay after surgery, a lower chance of infection, a lower risk of bleeding and blood transfusion, and a shorter recovery time, meaning a faster return to normal life.
As long as their job requirement doesn't mean that they have to lift heavy things, they can go back to work within a week.
Graciela, whose partial hysterectomy took about 3 hours, did experience minor discomfort the day after her surgery.
The nurses and the nursing staff there was very helpful to alleviate that pain and keep me comfortable. By the second day, I was discharged, and after that, I really did not experience any more pain at all.
Graciela, who started doing light activity about 3 days after her LESS procedure, can't believe she was back to normal within a week.
I was able to, do regular activities, and then within 2 weeks, I was about 100% recovered. So it was a good recovery experience.
And Graciela encourages other women who have to undergo a hysterectomy to consider LESS surgery.
The 2 benefits that I feel that are the most important is the no scar and the quick recovery time.